beautiful sunny afternoon, just taking a little walk after my lunch to hopefully curve down the blood sugar spike because I did have some pasta. So the question is, can you take hydrophilic medications like dutasteride or oral minoxidil sublingually and expect the same effects as you would if you were to take the medication orally? That's a very good question. It really depends, because when we're thinking about just lipophilic medications versus hydrophilic medications, we're only thinking about one component of drug absorption. When we think about drug absorption, we also have to think about things like the pH of the environment that it's being absorbed in. For example, the mouth, the pH in the mouth is slightly acidic. We also have to think about things like, is this a passive diffusion mechanism? Or is it something that requires active transport? Or is it something that's engulfed by a cell to bring into the system? And that's what we call endocytosis. So lots of different factors. We also have to think about whether this is a medication that requires first pass metabolism for your liver to convert to its active form before it actually works. We also have to think about, is this a medication that we need to absorb into the body to get an immediate onset of action for example, something like sumatriptan, a medication used for migraine headaches, or something like nitroglycerin that you need the effects like right there and then because time is muscle to the heart. If it's a commercially available product that is sublingual, then yes, it was designed and it was studied to be used as sublingual. If you want to experiment, you should probably talk to your doctor or maybe even a compounding pharmacist. They may have a little bit more insight in terms of whether things can be taken by a different route, say, for example, sublingual as opposed to just swallowing the pill, possibly a little bit better than a regular community pharmacist would, or even a hospital pharmacist. So long story short, lipophilicity and hydrophilicity is only one component of drug absorption, and that we should probably not just try things for the sake of trying. I'm assuming that there's a good reason for why you're asking the question of whether you can take this as a sublingual. I'm hoping that you do speak with your doctor or pharmacist to hopefully manage your medications if you're not able to take it as an oral tablet or whatnot, and you want to take it as sublingual. So that would be my suggestion for you. Again, this should not be considered as medical advice, but it is certainly some education that hopefully you will find helpful. So thank you all for tuning in, and we'll see you in the next one. Say no to drugs.